Well, Massachusetts could be days away from a new mandate on wearing face masks.
Here to answer your questions is Dr. Mark Seidner, epidemiologist within the Department of Infectious Diseases at Mass General Hospital. Dr. Seidner, thank you so much for joining us this morning. The CDC now says fully vaccinated people do not need to wear masks inside or outside. That new guidance applies to about 45% of this state's population. So does that mean for them that the COVID-19 pandemic is basically over?
Yeah, I see this vaccine as an opportunity to feel a sense of security that I think most of us just haven't had for the last year. Ticket to see loved ones, to travel, also a commitment to helping our community, because every last dose, I think, helps not just ourselves, but those around us. But, since we're part of communities, it's not the end of the epidemic. There are many who remain unvaccinated, and there are those who are immunosuppressed who aren't going to get the same benefit that most of us do. So while they're extraordinarily effective, they're not 100%. So we still need to have some common sense things in mind, like staying home or getting tested if we feel sick or have symptoms. I'd basically say we're the closest we've been since this thing started to it being over, but not quite over the finish line yet.
Good to remember that testing tool, too. And Governor Baker said he plans to update us on the state's reopening plan early next week. What advice would you give him about face masks?
Yeah, two things. I think the first, as I think we've always said, is to have the policy follow the science. It's been very reassuring to see the last couple of months, cases down, hospitalizations down, deaths down in places like Massachusetts and other parts of the world where vaccination rates are up. But with the new epidemic and, of course, with new variants, things are constantly changing. We should get better data soon on things like transmission indoors in vaccinated people, something we still know relatively little about. So let's keep using that data and helping it to make policy. The second is that I think we've all been wrong before in some predictions we've made over the past year. I certainly can say that. So if we find that masks come off and rates go back up, we have to remember this isn't a one-way street.
Okay, the mask mandate remains in place for airplanes, buses, public transportation. Why is that? What does the data show about the risk of traveling?
Yeah, I think this really gets at the idea that one size does not fit all. These vaccines, of course, are extremely effective, but they're not 100%. And they do seem to be less effective in some groups of people, like the immunosuppressed. So while people can, of course, choose to go to the movies and choose to go out to dinner, they can't necessarily choose to go to work. And public transport is something people use to get to work. They're also small enclosed places. So I think when we see vaccination rates get up to 80% and cases and deaths coming down even further, some of these other restrictions are going to start to come off too.
One group that is not vaccinated yet is kids under 12. Do they still need to wear face masks around others? What's your advice?
Yeah, these guidelines are for vaccinated people. Unvaccinated individuals should still continue to wear face masks indoors when they're not around their immediate family and in prolonged closed situations. They also don't pertain to every situation. If you are someone or have someone in your family, again, who's immunosuppressed or potentially had an organ transplant, you should use this as an opportunity to speak to your provider and see what these rules mean for you. We're a state of 7 million people. This rule won't pertain to everyone. We also have communities that have 70 to 80% vaccination, others that have 40%. So we need to keep that in mind when we decide how to interpret these kinds of rules.
Okay, Dr. Mark Seidner, epidemiologist at Mass General Hospital, thank you so much for joining us this morning.
Thank you.